Hi, I'm Shanice Jones, and I will be discussing how to perform a blood glucose monitor, the patient's 6 rights of medication administration, how to mix insulin, and how to administer insulin, and how to perform an IM injection. So first, I'll be talking about the patient's 6 rights of medication administration. So first, you want to identify the right med, right dose, right route, right patient, right documentation, and right time. Also, for CBG or blood glucose, first I would gather my supplies and verify my physician's order. Then identify my patient, ensuring that I have the right person, as said before. And then I'll gather all my supplies. I'll wash my hands, don gloves, have my patient wash their hands as well, so you have a clean site to begin with. And then I would grab my make sure I have my lancet, my test strip, and glucose monitor. Make sure it's turned on prior to, and make sure I have some gauze or a cotton ball and some alcohol prep to clean the site. So first I would examine which finger I want to use for my patient. Then once I've established that, I will then clean it for 30 seconds with the alcohol prep. For 30 seconds, let it dry. And then I would take my lancet, pierce the skin, allowing the first drop of blood to pass, swipe it away. And then the second drop of blood, that's what I'll be collecting. And I would collect it on my test strip, like so. And then letting it read. And then I will explain the results to my patient. 60 to 110 is your normal range for a blood glucose. 110 being on the high spectrum, 60 being on your low. Below 60 is hypoglycemia, 110 and above is, above 110 will be hyperglycemia. Then once I've done that, I'll then wash my hands, throw away my materials, wash my hands, disinfect, document the time I've done it, the patient's readings or results, and how the patient tolerated the procedure. And then I will verify my patient's order to begin insulin administration and determine if my patient's on a sliding scale. For insulin administration, you can use a syringe, you can use an IV drip if need be, or they have the insulin pens. So that's what I'll be doing next, and before then I'll wash my hands.
Hi, I'm going to be performing administration of insulin and mixing of insulin. First, my supplies, I have my 2 insulin vials, a Band-Aid, gauze, alcohol prep, and my syringe. First, I will introduce myself, provide privacy, perform hand hygiene, and put on gloves. Next, I would assess the doctor's order in the MAR and ensure that I have the correct order. I will then check the insulin dates and make sure that they are not expired, and they are not. So the doctor's order says that the patient's getting about 30 mLs of insulin altogether. So 15 of NPH and 15 of regular. So second, I would take the tops off of both insulin vials, take my alcohol prep, scrub the tops for about 5 seconds on each. Set that aside. Then I would take my insulin syringe. I would take the top off. Pull back about 15 mLs of air. And we're going clear to cloudy. After I have rolled my insulin to ensure that all the particles are mixed together, I'll then insert the needle, aspirate my 15 mLs of air, and then do the same on my regular insulin. Now, once I've done this, I will then not take out the needle, but I would draw back from this and draw back 15 mLs of my insulin. And then inject the needle into my NPH. Draw back another 15 until I get to my needed dose of 30. Once I've done this, I will verify with another RN to ensure that I have my insulin prepared correctly. I then will check the MAR again and ask the patient to give me their name, date of birth, to ensure that it's the right patient. So I would do my 3 checks. Once I've done that, I will tell the patient that I need to inject the insulin into another area than previous administration. I will scrub the skin for about 5 seconds to ensure that the area is thoroughly clean. Pinch the skin about 2 inches and inject at a 90-degree angle. This is for a sub-Q injection. Once I've done that, I will then take my needle, put it in the sharps after I have put a gauze and a Band-Aid on the patient's skin, ensuring that there's no bleeding or seeping of the medication. And then I would discard my needle into the sharp spin. After that, I would take off my gloves, wash my hands, and document how the patient responded to the procedure. Okay, after doing the procedure of mixing and administration of the insulin, in a few hours, I would reassess the patient for hypoglycemia and hyperglycemia. With hyperglycemia, the patient may suffer from headache, dry mouth, and then hypoglycemia, the patient may be lethargic, sweating, diaphoresis. For Humulin R, the rate is about 2 hours for duration, and then the therapeutic range for NPH is about 8 hours.
Okay, so now I will be discussing IM injections. So first, I will check obviously my MAR and my doctor's order to verify my patient and 6 routes of medication administration. And I will then explain what I'm doing, and then we'll begin. So first, I would perform hand hygiene and don gloves, and then I would assess my patient's extremity that I'm going to be using for my medication administration, determining if they have any type of infection or wounds in the area that would probably prohibit me from administering the medication. So then I would compare the medication to the MAR, making sure I have the right medication, the right dose. And then we're going to do my 3 checks because you do not want to do a medication error. And so then I would check it again after I draw it up, and I'll check it again before I administer it when I'm in the patient's room. So first, I will then say I had 20 mLs that I had to give my patient. So first, what I'll do is take my vial, clean the top, scrub the hub, they say, for 5 seconds. I'm going to take my needle, and so I said my order was for 20 ml, so I'm going to draw back on my syringe for 20 mLs, and that's what I'm going to inject into my vial. So I inject the air, and then I'm going to withdraw 20 mLs back into my syringe, and then making sure I pull it out slowly. And then I have that prepared. Do not recap the needle And before I administer, I would clean the site that I'm using to inject. So like you can use for IM injection, you can use the deltoid is commonly used. Ventrogluteal area is commonly used, or the glute. So I'm going to use the deltoid in this case. So I'll label my syringe knowing which medication, depending if I have like several meds, I'll label my syringe before doing all of this. And then the Z-track method, I go at a 90-degree angle because this is IM. And then I would inject it, hold it for 10 seconds, slowly aspirate, and then withdraw, and then I'll clean the area site with alcohol prep. And then I would dispose of the needle into the sharps because of biohazard, and you do not want any puncture or go to occupational health. So then after that, I remove my gloves and wash hands.